Hello, everybody. Thank you so much for being here today, and thank you for everyone who's joining on Zoom and on YouTube. I want to start by saying that whether you are a student or faculty or staff or researcher or journalist or academic or whatever, your presence today here in person or online is a sign of courage. And there's an old quote that I saw on Instagram recently that says that your principles don't matter until they cost you something. And I know that showing solidarity in this environment is really costly. And so thank you for being here. And though we don't really know each other very well, it's safe to say that we are all sharing the same feelings now. And some of the most common words you have shared with me over the past teach-ins are actually, I'll show the word cloud. These are some of the words that you have shared with me over the past teach-ins. And some of the most frequent ones are anxious, scared, disappointed, worried, heartbroken, devastated, and frustrated. But you have also expressed that by being together in these spaces, we can share the burden of despair. A few housekeeping items. I kindly ask that you disconnect from your devices and reserve your full undivided attention to our speakers. One of our speakers, Dr. Hadeel Masri, is Zooming in with us at 1 a.m. in Palestine, so we really appreciate you. Thank you for being here and staying up so late for us. And to ensure that this remains a safe learning space, please don't take pictures or videos of the audience. These sessions are recorded, they're live streamed, and they will exist as a repository, an educational repository on YouTube if you want to go back and look at the material that was shared today. If you are on Zoom, please use the Q&A icon to post your questions. And after our keynote speaker, we will be joined by Dr. Hadeel Masri and Dr. Deborah Harrington for a panel discussion. Though we are doing our best to design this as a safe learning environment, I also want to reiterate that the main goal of these teach-ins is not to try to convince you of anything, but try to ignite your curiosity in the subject matter. Try to make you use critical thinking skills to recognize the truth from the sea of misinformation out there. And so if you go home tonight and realize that you feel compelled to look up stuff to fact check the information that you heard today, then we have probably achieved our goal. And before I introduce our keynote speaker today, Dr. Alice Rothchild, I would like to dedicate this session to Dr. Hamam Al-Louh and all the innocent lives lost. Dr. Al-Louh exemplifies what it means to be a healer and the reason that I and probably many of you decided to work in the field of healthcare. So to start the session, I would like to amplify his voice.
Why don't you go with your family south?
And if I go, who treats my patients? They are not animals. They have the right to receive proper health care. You think I went to medical school and for my postgraduate degrees for a total of 14 years, so I think only about my life and not my patients? I'm asking you, ma'am, do you think this is the reason why I went to med school? To think only about my life?
And with that, I'm going to just do a quick shout out to everybody who's joining us from all across the United States. Students from UMass, Yale, University of Ohio, Columbia, Rowan University, NYU, BU, Michigan State University, St. Louis University, Mayo Clinic, University of Washington. And with that, I would like to start introducing our keynote speaker, Dr. Alice Rothchild, and one of my role models. Dr. Alice Rothchild grew up about an hour away from here in Sharon, Massachusetts. She graduated from Boston University School of Medicine in 1974. In between 1977 and 1979, she was the medical director for the Women's Community Health Center in Cambridge. After completing her residency in OBGYN, she co-founded Urban Women and Child Health in Jamaica Plain, providing OBGYN and pediatric care to marginalized communities in Massachusetts. And before retiring from clinical medicine in November 2013, Dr. Rothchild was actually here as an assistant professor of obstetrics and gynecology and reproductive biology at Harvard Medical School. She is now a corresponding member of the faculty here at HMS. One of my favorite facts about Dr. Alice is that she contributed to the first edition of the seminal piece of Our Bodies, Ourselves, and she later joined Women's Consciousness, raising activities, and worked for healthcare reform on the grassroots levels. In 1997, through her involvement in the Boston Workmen's Circle, Dr. Rothchild turned much of her non-medical focus to understanding and writing about the Israeli-Palestinian conflict. She worked with a number of local and international groups and is now active with Jewish Voice for Peace on the national level as a member of the JVP Health Advisory Council and on the board of the Gaza Mental Health Foundation. Just World Educational, and we are not numbered. Thank you for tuning in with us from Seattle, Dr. Rothchild. It's your turn to speak.
Well, thank you so much. I'm just going to bring up my slides here. So I'm going to be, let's see, how do I make this go away? I'm going to be talking, I was asked to talk about health equity in Palestine with a focus on women. And just, okay, I'm going to have trouble advancing my slides again. Okay, so let me see. Okay, so as you have figured out, I have multiple identities, both as a clinician and a human rights activist, and I'm also a writer. I've written 3 books on health and human rights issues in Israel-Palestine and a young adult novel. And I made a documentary film called Voices Across the Divide, which is also about this topic. And I see my role as working in solidarity in times of conflict situations. So I was involved in health and human rights delegations from 2003 until now, except for the COVID pandemic. So I was last in the region in August, and I was traveling all over. And these are the books that I've written. They need a microphone. And so I saw myself as the microphone. And over the years, I got to work with a number of incredible organizations, including Physicians for Human Rights Israel, B'Tselem, the whole list is here, Gaza Community Mental Health Program, Palestinian Medical Relief Society. So I really got educated by the folks who are working in the region. And what I learned quite quickly is that healthcare is provided in the context of checkpoints, closures, curfews, a strict permitting system, bypass roads that are open only to Jewish settlers, the separation or apartheid wall, Israeli incursions, and then massive assaults, frequent detentions of civilians, and also factional violence. And I think if we're looking at healthcare and we're going to focus on women, there are some ethical questions we need to keep in mind. One is the role of international law, the use of collective civilian punishment, restrictions of access to healthcare facilities, what happens when you ghettoize a whole entire population, the level of incarceration that's going on, especially for children. And this is particularly pertinent right now. What is the proportionality in war? And what we see is that healthcare and healing occur in the socio-political context. So we have a need for political solutions to health and human rights issues. And one of the questions you should ask right at the start is, why is life expectancy in Israel 10 years more than the West Bank and Gaza? Why is maternal mortality 9 to 10 times greater in the occupied territories than in Israel? So I think we have to be upfront and address the issue of the fact that multiple human rights organizations have said that the Israeli policies qualify as an apartheid regime and that they have committed war crimes in previous wars. And this is just a statement from B'Tselem, which is an Israeli human rights organization, and they stated, a regime that uses laws, practices, and organized violence to establish and maintain the supremacy of one group over another is an apartheid regime. And we saw this during the onset and peak of the COVID pandemic. I was part of a group that issued a weekly report on COVID infections in the impact of COVID in Israel and Palestine. And so the medical apartheid issue became really clear. And what I mean by this is that with the Oslo Accords in 1993, the Palestinian Authority was established to maintain healthcare in the territories. But the Oslo Accords were predated by the Geneva Accords, which mandated that occupying powers are responsible for the treatment and prevention of the spread of contagious diseases and epidemics. But the Israeli government refused to recognize any responsibility. So what we saw was that Israel wanted Palestinians in the territories to have the responsibilities of sovereignty, which is providing healthcare, without the benefits of sovereignty, which is resources and control over the system. So how you did during the pandemic in that region of the world totally depended on your geographic, ethnic, and political status. And I'm just going to read this statement up here because it kind of sums everything up. More than 75 years of Israeli domination and dispossession has affected Palestinian life through occupation, siege, annexation, de-development, and permanent displacement of refugees, severely impacting the ability of Palestinians to access the essential building blocks of health. The fragmentation of society and destruction of the ability and opportunity to create essential institutions involved in healthcare has created a reality that is recognized today as medical apartheid, two separate systems, two separate realities. And again, we saw these dramatic disparities in life expectancy and infant mortality. And this occurs through an organized de-development of the healthcare system, much more pronounced in Gaza than in the West Bank, but true in both places. The creation of a severe medical permitting system for people who want to get high-level care or need high-level care outside the territories, chronic lack of medications and equipment, the impact of direct attacks, and high levels of conflict-related trauma. I also want to just put front and center a little awareness about Zionism and medicine. We know that in 2018, the Israeli Knesset, their parliament, passed the nation state bill, which officially legally privileged Jewish citizens of Israel over Palestinians. So there is official institutional racism in this country. And so the question you have to ask is, are Jewish Israeli clinicians able to see Palestinian citizens of Israel or Palestinians in the territories as fellow equal human beings? And just this month, there were almost 100 doctors that wrote a letter approving the bombing of Gaza hospitals. So clearly, some people cannot do that. Now, I'm going to be talking about health in its broadest sense. And Physicians for Human Rights established a list of what is involved in the right to health. And this involves the freedom of movement and access to health services, and then all the things that make up a clean and functional society: water, sanitation, nutrition, housing, the ability to have an education, to get employment, and to live in a nonviolent society. And the picture on the right is a patient education pamphlet from the Palestinian Medical Relief Society. So along with, the importance of breastfeeding and taking your calcium, this is what to do when you're in labor and you're stuck at a checkpoint. And as we think about all the things I'm going to talk about, I want to just remind you what the Geneva Convention state. And basically, it states that an occupying power must not interfere with the ability of medical personnel to perform their tasks and their humanitarian functions. So this is the backstop that we need to be constantly thinking about. Now, healthcare in Palestine has been described in the Lancet as fragmented and coherent. And I just want to review how it goes here. So the Ministry of Health was established in 1994 after the Oslo Accords. And then we have the United Nations Relief and Works Agency, otherwise known as UNRWA, which is responsible for refugee health. So in Gaza, there are 8 Palestinian refugee camps, and in the West Bank, there are 23, and then there are other ones in other parts of the Arab world. Then we have a host of non-governmental organizations. We have private providers, and then we have the role of the Israeli government in de-development. And if you're a Palestinian who lives in East Jerusalem or in Israel, 48, then you have access to the 5 HMOs that are accessible to other people, as well as private care. And that's a whole different conversation, which I'm happy to have later if you want. So just some quick facts about occupation, because it's important to really understand what life is like. There are some 500 checkpoints in the West Bank, a strict permitting system if you want to go from point A to point B. There is the separation or apartheid wall. 85% is built in the West Bank and snakes around the Jewish settlements. There are some 500 miles of bypass roads, which are accessible only to Jewish settlers. And there are some 800,000 Jewish settlers in the West Bank and East Jerusalem neighborhoods. Thousands of Palestinian homes have been demolished, olive trees uprooted, and the Palestinians who live in the territories live under Israeli military rule. And as an example of what that means is that if you are tried in an Israeli military court, you will be found guilty over 99% of the time. Now, in Gaza, there were Jewish settlements in Gaza, and they were unilaterally withdrawn in 2005. And in 2006, there was a legislative election where Hamas won. And then the following year, there was a civil war between Hamas and Fatah, which was the other group that was prominent in the West Bank, and Hamas won. And that is when the severe siege of Gaza started, led by Israel and the US and joined by the international community. Now, folks in Gaza have had multiple massive assaults. We're on number 6, and they've lasted somewhere between 2 days and 50 days. We're about day 37 now. So this assault started on October 7th. So each time there's massive destruction, and then there's attempts to rebuild whatever was destroyed, and how far it gets depends on how close together the assaults are. The other thing is that between 2018 and 2019, there were weekly protests called the Great March of Return, calling for recognition of Palestinians and the right of return and a whole host of things that are their due. And this was met with massive sniper firing and resulted in a huge amount of injuries, death, and a lot of orthopedic injuries because snipers would shoot at the legs of the protesters. Now, there are particular challenges for women living in this setting. And I just want to say, just to start, is that there are all different kinds of Palestinian women. They're not a homogenous group. And some of it is socioeconomics. Some of it is, are they in an urban setting or a rural setting? So I'm going to make some generalizations, but clearly they don't apply to everybody. And I'm happy to, dissect that out later if you want. So there is a tendency in this society for early marriage and large families, and the women are responsible for the children. And there is a tendency, not with everybody, but of having conservative attitudes, particularly towards the roles of women and on the issue of LGBTQI. There's a tremendous stigma, not only for women, but for everyone regarding mental illness and mental health. There's a tremendous amount of poverty because of the economic situation. There are issues around gender-based violence, and we see that men who have been humiliated and unable to find employment and have had stints in prison and just been traumatized in a whole lot of ways do what men do in many societies, which is they take their rage and their humiliation out on their wives. There's also racism within the society. If you get to know Palestinians, some of them are blonde and blue-eyed, and some of them look like Africans and come from Chad. You have to remember that Palestine was a major trading area, and it was invaded by a lot of different people. So there's a lot of different colors of people there, and there is racism towards darker people. We do also find that women are very educated in general, but have tremendous difficulty finding employment. So living under occupation and siege, they live with a tremendous amount of loss and trauma. When accessing healthcare providers, there is a huge range of skill set because providers have been educated sometimes in Romania, 30 years ago, sometimes more recently. It's very hard to update skills, and getting access to healthcare is very difficult, as well as paying for it. If you're a refugee, it comes under UNRWA, but otherwise it's a pretty confusing mess. There's also a different way of medical decision-making because let's say you have a breast lump, and in a first world country, you might get an ultrasound, a mammogram, and maybe see a surgeon for evaluation. Well, in the territories, you have to think about how many checkpoints do you have to go through to get to what? What's it going to cost? So there's a lot of decisions that are made that are related to the fact of occupation rather than what is optimal medical practice. There is also a lack of screening, a lack of diagnostic and therapeutic options. The Israelis don't allow any radioisotopes or radiotherapy. Mammograms are hard to get and even harder to get them read. And breast cancer is a major cancer in the occupied territories. And this is true of all the cancers, that it's very hard to get treatment. And so when you need treatment, you need to get permits for high-level care, mostly in East Jerusalem and beyond. Women also have tremendous strengths. They are the main cohesive force within families. They are highly valued in the culture. There's a tendency to live in multi-generational settings with connections and support. They're famous for their samud, or their ability to persevere. And as I said, tend to be highly educated. And then there's a tremendous amount of pride in cooking, joy, and love of life that is always striking to me when I'm with families. Now, I want to make some just quick first personal observations about the kind of care people get. And so I describe care as kind of first world, third world, as a kind of interesting blend. And I'll give you just some examples. So I was in Al-Ahli Hospital in Hebron observing a C-section, and I would say the OR standards were definitely third world. There was an OR suite, a scrub room, and an OR suite that was connected. So the people having a section in the second room walked through the first room, infected babies got carried through. It was just like not what we would do in our institutions here. And the women were delivered under general anesthesia. There was no epidurals or spinals. I was in a Ministry of Health hospital that treats, has hundreds of deliveries every year. And the delivery room had 3 delivery tables, the most uncomfortable things you could imagine, all in a row. So the women were delivering without privacy, without support, sort of a, bring them in, pop the baby out, next kind of situation. And the hospital was very, very busy. But then I was in a birth center in the village of Maithalun, which could have been a birth center in the United States. So you see this huge range of care. Patients tend to have minimal time with clinicians because they are so overwhelmed. And this is especially true in UNRWA clinics. Physicians will often see 50, 60 people an hour, so you don't get a lot of time to talk about your problems. And if you look at maternal mortality, in Gaza, about half of the women die from bleeding to death and about a quarter from sepsis. In the West Bank, it's a little different. Pulmonary embolism and preeclampsia are the 2 major causes of death, which is a reflection of the fact that the West Bank is more developed and has better quality and access than Gaza, but still, people shouldn't be dying of these things. In terms of gynecology, what I found was that most women had almost no knowledge about how their bodies worked, particularly prior to marriage, and then marriage was a quick education about some things. Women tended to use contraception for spacing. The IUD was the most popular contraceptive, and if you think about it, if you have trouble with access, all you have to do is get that IUD in and out. So there's 2 visits rather than going to the pharmacy every month for your birth control pills. There were a lot of issues around the expectations for an exam. Women tended to be very modest. I could spend hours trying to convince a woman to have a pelvic exam, and everyone wanted an ultrasound. They came in for vaginitis, they wanted an ultrasound, and that seemed to be what people did. So it was a little wackadoodle as far as I could tell on that. I found that women tended not to exercise very much because of all the restrictions and movement. And there had been major dietary changes over the decades because of all the loss of agricultural land and the dependence on the neoliberal Israeli policies and food imports. There was also a tremendous amount of shame around gender-based violence and rape. And I had some very heavy conversations with mothers whose daughters had been raped and were now ruined as far as their mothers considered. Now, I'm going to focus on Gaza because that's where the most horrific things are going on, although the West Bank is certainly aflame. I have been to Gaza 4 times, each time with an NGO, and I was always invited by the Gaza Community Mental Health Program. So I was last there in August. And again, over the years, I've done direct services, women's empowerment sessions, a lot of interviewing, documentation, and a lot of writing. And as mentioned, I'm involved with a number of organizations that are involved with Gaza. So before the aggression, there were 13 governmental hospitals, 142 primary healthcare centers. You can see Ministry of Health, UNRWA, and NGOs, about 40 private hospitals, 2 medical schools, and then a lot of professional schools. But there's a real disconnect between the people that are being trained and the ability to hire them and pay them. So there are 120 nursing positions open in Gaza each year, and there are 5,000 nursing students in Gaza. There are less than 20 psychiatrists in Gaza, and less than 7 of them are doctors. Now, the big health issues in Gaza, involve a lack of electricity. And this was before the aggression. So electricity was in the 4 to 8 hours per day, and it was not always at the same time, if you can imagine that. There were tremendous fuel shortages even before, with hospitals having to close. extreme restrictions on permits to leave, these chronic shortages of medicine and equipment, and then because of the lack of ability to get training outside the Strip, a lack of the specialists, and an exhausted medical personnel. Excuse me. There was also a long history of people not getting paid, and then this was all layered by the COVID-19 pandemic. We also had a lot of issues around UNRWA. This was, they're responsible for the refugees, so their budget was completely slashed by Trump. It was partially restored by Biden. And before the latest aggression, UNRWA was threatening to cease operations because they were having a budget crisis. There was donor fatigue. There's so many other starving people all over the world kind of situation. And this was all going on in the face of deepening poverty, malnutrition, and rising unemployment. Now, not only does Israel have an enforced strict siege of Gaza, limiting what goes in and what goes out, there are other ways that they have figured out to make Gazans miserable. And one of the things that they do is fumigate farmlands with herbicides. And so along the eastern border, which is a perimeter fence, they will fumigate the farmlands there. That's the most agriculturally positive land in Gaza. They've also decimated the fishing industry. Gaza is a coastal plain. It used to have a huge fishing fleet, and that people ate a lot of fish. And now fishermen have severe restrictions on how far they can go out. Their boats get attacked, they get shot at. It's just horrific. And I've interviewed fisher folk and gotten the whole story. The other thing the Israelis do is that they have these wells along the eastern perimeter fence. And right when the crops are ready to be harvested, they will intentionally flood the fields to prevent Gazans from being able to harvest their crops. So there's a lot of ways that the siege is utterly oppressive. And then we have 2.3 million Gazans, and half of them are under 18 years old. So it's a very young population. So I'm going to look at what's going on now, and I put these numbers together a few days ago, but what we're seeing is the total disintegration of healthcare. And I don't know how to make the banner go away so I can read my slides, but there's been, over 11,000 people killed, 2/3 of women and children. There's probably now close to 30,000 people injured. There were several thousand under the rubble, including about 1,500 children. In Israel, 1,200 were killed in the Hamas assault, and 5,400 were injured. And now there have been 47 soldiers killed in Gaza, and there are some 240 hostages. Now, if we look at the Israeli bombing, no matter what they say in terms of protecting civilians, what we see is a very bombing that's indiscriminate. So homes, civilian gatherings, markets, bakeries, restaurants, and in particular hospitals, healthcare facilities, ambulances. I just learned about an hour ago that Al-Shifa Hospital, which had been the maternity care in the outpatient department, had been bombed. Now there's a bomb that went directly into the hospital. And this is all going on while there is a full electricity blackout and a lack of fuel. And the thing to understand about fuel is it's not only used to drive the ambulances, give the ambulances a source of energy, it's also used to drive the electricity generators that keep the hospital functioning. And what we see is that the Gaza City hospitals, particularly in the north, including Shifa, which is the major, 800-bed hospital, are directly under attack. And there's a lot of fighting around the edges of the hospital, and scores of patients have been trapped, have been killed. And as I said, the maternity department was struck. So I'm having, this is so weird. I don't know how to make this go. Here we are. So then if we look at other things that have been bombed, almost half of the housing units have been destroyed. 1.6 million people have been internally displaced, if at all. I'm now reading about people not having any water, the missing gender-based violence. And in the middle of this, you have about 50,000 pregnant women who are having no prenatal care. And you've been probably hearing a lot about the premature babies in the NICU. So if you think about any patient who's totally dependent on electricity, it's premature babies in the NICU, adults in the ICU, adults on dialysis. All of those kinds of patients are now suffering and are beginning to die due to the lack of electricity. In addition, there have been direct attacks on healthcare personnel. Almost 200 personnel have been killed, 51 ambulances destroyed, and a huge number of the hospitals and health centers are now unable to function. There have been no medical permits to the West Bank or Israel since this all started. Doctors are also reporting unusual burns on the dead and the wounded that are highly suggestive of white phosphorus, which is illegal. And women also are troubled because they have no menstrual products. And there were even stories about women starting birth control pills so that they could postpone having their menses during the attacks. Now, we see, as you can imagine, that this has a huge, huge impact on mental health. And what we're seeing amongst children is a massive amounts of behaviors that are consistent with traumatic stress disorder. So children have been developing convulsions, bedwetting, which is a very common symptom in the occupied territories, fears, aggressive behavior, nervousness, and refusal to leave their parents' side, which is usually their mother's side. And at the Rafah crossing, which is the crossing with Egypt, it has been closed most of the time. There have been under 1,000 trucks that have been able to get in, and they've been carrying food, water, and medical supplies, but no fuel. And the last time I checked, which was about 2 days ago, there were no essential food commodities left in stock in Gaza, and there was 12 days worth of wheat, but no ability to mill it because there was no electricity. Now, the Israelis have been saying that the hospitals in the north have to be evacuated, but they have not. And if you think about it, evacuating a major hospital facility at a time when there's no electricity, water, or fuel, and would be technically impossible. The ambulances are not available. And then the question is, where are they being evacuated to? It's not like there are hospitals in the south that have beds for these patients. So this is just catastrophic, and the hospitals are failing and way over capacity. The other thing is that a lot of people shelter around the hospital because they feel like it'll be safer there. So there are tens of thousands of internally displaced people on hospital territory. Now, the other thing in terms of the destruction of the infrastructure is groundwater. And so it's being produced at less than 5% of pre-hostilities. And most of the sewage pumping stations are not where it is being dumped into the Mediterranean Sea. And I should tell you, people are bathing in the sea. They're washing their clothes in the sea. They're taking that water home to drink. This is catastrophic. So you can imagine the kind of illnesses that are showing up. And then you have all these families, a family of 40 or 50 cousins, aunts, uncles, all squished together in an apartment, and you see an upswing in chickenpox and scabies, diarrheal diseases, respiratory illnesses, and there's now talk that there might be a cholera epidemic. The other thing is that over half of the educational facilities have been bombed, which not only affects the society and the culture, but a number of these were UNRWA schools that were used as emergency shelters for internally displaced people. Now, the UNRWA has reported that over 100 of its staff have been killed, mostly teachers. We also know that Palestinian armed groups are continuing to shoot indiscriminately into Israel and are also engaged in a tremendous amount of ground fighting in Gaza. And what we see is that there's been a huge toll on the civilians in terms of injury and death. And many, many groups, including people like me, are now naming this a genocide and calling out the war crimes that have happened. Now, just to give you an example, this is the Gaza Community Mental Health Program. This is their newest center. It opened in 2019. They have 3 centers and 5 mobile clinics, and they do training, direct care, a lot of community education. And their main focus was on women, children, and prisoners. And one of their theories was if you can treat the women, they treat the children, and then they help their husbands, and it all turns out better. And their big focus is on chronic traumatic stress disorder. Now, this whole neighborhood has had a massive amount of bombing. The roads are cratered. The windows on this building all were blown out by all the bombing. And I've been unable to find anyone who could tell me if the building itself is still standing. All the centers are closed. There is a hotline that patients can call, but they have no electricity, so they are having trouble doing that. Patients were given the phone numbers of their therapists, but again, no one has electricity. This center provided free medications, and patients now have to buy their own medications if they can find them. So this is all catastrophic. And then on top of that, The staff are as traumatized as the patients. The staff fled south. The staff have died, have been bombed, have had their homes bombed. I mean, it's just, they're all now in the same boat.
Dr. Rothchild, I'm just going to ask you to wrap up in a couple of minutes so we have
Sure.
time for the Q&A. Thank
Okay,
you.
sure. Now, if we look at pregnant women, there are over 5,000 births per month, and you have to remember that these women have not had prenatal care. They don't know where they're going to deliver, and they are giving birth in all sorts of horrific conditions, and there are C-sections without painkillers. It's really terrible. And with the lack of water and clean food and water, not only affects their health, but the health of the mother, the ability to bond and breastfeed. So we're going to see a rise in maternal deaths and a rise in the psychological toll that then produces more stress-induced miscarriages, stillbirths, and premature death. So I think the big picture is structural racism, apartheid, and cross-generational trauma, the reliance on military solutions to political problems, the disregard for the health and lives of Palestinian people, and Israel's inability to be responsible as the occupying power for the healthcare of the occupied. So the status quo can only continue if we as human beings see Jews as more human, more deserving, more innocent, and honorable than Palestinian Arabs, if we as a community are blind to Arab suffering and the history of settler colonialism. So the fundamental issues come down to racism, which potentially leads to ethnic cleansing and genocide. And we can see that the health of Palestinians is intrinsically linked to their liberation and the end of the siege. And so my final slide is a quote from Ruhama Martin, who founded Physicians for Human Rights Israel. She talked about how Jewish Israelis live in the politics of the last atrocity without historical memory. And she asked, how does Israeli behavior contribute to Palestinian resistance and violence? And she's written a lot about the separation of the apartheid wall, both as a physical barrier and a metaphorical blinder that conceals the existence of Palestinians and dehumanizes them. And she also writes about how this has a huge personal price for Jewish Israelis and their humanity as well. Thank you.
Thank you so much, Dr. Rothchild. We're going to move to the Q&A portion, and Dr. Karame is a pediatric neurologist at Boston Children's, and she'll be moderating the Q&A. I would just like to introduce quickly our two other panelists, who are Dr. Hadeel Masri and Dr. Deborah Harrington. And I will try to... Dr. Harrington, would you mind putting your camera on so we can spotlight you on the screen as well? Okay. Dr. Hadeel Masri is a practicing consultant OBGYN. She completed her PhD in detection and prevention of obstetric anal sphincter injuries in Palestine at the University of Oslo in Norway in 2018. Her research project resulted in improved diagnosis, management, and prevention of maternal childbirth trauma. She is currently involved in midwifery research and education development project titled Exploring Quality of Maternal and Newborn Care in Palestine, which is a collaboration between Birzeit University and the Ministry of Health in Palestine, Oslo Metropolitan University in Norway, and the University of Ghana. Dr. Hadeel has been the head of Women's Health and Development Unit at the Ministry of Health since 2020. She co-leads the national efforts to protect sexual and reproductive health and rights for Palestinian women in partnership with NGOs and UN organizations. Dr. Al-Masri is also a former member of the Palestinian OBGYN Scientific Board Committee and a current member of the Palestinian OBGYN Specialty Program Supervisory Committee. Thank you for being with us here, Dr. Al-Masri. I know it's 1 a.m., so thank you so much. Dr. Deborah Harrington is a consultant obstetrician and subspecialist in maternal and fetal health medicine at Oxford University Hospital, in one of the largest maternity and women's health units in the UK. She specializes in the care of women with complex medical conditions in pregnancy and birth. She is also the head of the Postgraduate School for Obstetrics and Gynecology for the Oxford Deanery and Deputy Director of Medical Education at Oxford University Hospital, a member of the Shelford Group of Teaching and Research at NHS Trusts in the UK. She is a member of the Senior Educators Advisory Committee at the Royal College of Obstetricians and Gynecologists in the UK. She has been visiting Gaza since 2017 as part of a group of medical teachers led by Professor Nick Maynard, consultant surgeons who have been visiting and working with medical colleagues in Gaza to provide clinical teaching to medical students and postgraduate doctors in training for over 15 years. And I met Dr. Harrington through Gaza Medic Voices, which is the Instagram account that was started a few weeks ago in the UK. Thank you for being with us, Dr. Harrington. And I will hand it to there are a few questions on here, but we can start with questions in the audience.
Anyone has any questions? I know this was quite overwhelming to hear, and it gives us a pause when we're just not able to process what we just heard. So I don't blame you for having questions, because this was a lot to absorb. We do have some questions online. Okay. Yeah. So there's a question from Sammy Buckley. Sammy says, thank you for your valid point. How do we pressure and plead for ACOC, RCOC to release statements to protect innocent women and the release and management of PPH and sepsis in low resource settings? So Sammy is asking, how do we advocate for patients in Gaza who are affected by this onslaught on their lives and the resources that they have? Maybe I would love to hear from Dr. Hadeel, actually, since she's on the ground in Palestine. Maybe she can help us answer this question, this important question.
Yeah, I believe, thank you, of course. So Sammy's question was about like the collaboration with the American College for Obstetrician, RCOG, the Royal College, and the FIGO. Actually, but we're working on that. It's just like, I understand that if it's from my side, like I am on the ground, then we have like these guidelines, because of course Dr. Alice has mentioned very valid points, and she also mentioned that we have a variety in the practices and this array actually, and all these clinical practice, let's say. Of course, we have very good graduate as well, and we understand that there's evidence-based practice. So we actually, what we do is that we take all this with the support with the World Health Organization and other organization nations, that we take all these guidelines and evidence practice and we consolidate them into a national guideline. And of course, with this maternal mortality reports that we analyze and review, we understand that it's a complex of factors. So it's not only related that sepsis because we have a problem with antibiotics or we have a problem with the hygiene or anything. It's a complex, system. The whole health system is very responsible for that. So we take every single factor and we try to work on it. So the reduction in maternal mortality in Palestine has been significant since 2009, that we had 34 per 100,000 maternal mortality ratio, and it dropped down to approximately 19 just before the COVID. And that's actually significant improvements. Still, we know that we have more than 70% preventable deaths. And of course, with the COVID, it was horrible. So the figures that Dr. Alice mentioned, they were just I think it was in 2020, but now the maternal mortality returned back to decline again. We still have these problems. So actually we have these guidelines to follow. And then we started with also seeing like, how can we just, it's about the practice, of course, and about how can you actually the equipment, the supplies and everything. Gaza, the problem with this prolonged siege, it's not only this war that has been under blockade for 17 years. So the transfer of the equipment and the medical supplies and medicines was also a problem. So that's the main thing. How do we do this? It's not about the RCOG and SCOG only. It's also about how to actually have these medicines in place and to avoid the stockouts.
Thank
I
you
hope
so
that
much.
answered. Yeah.
There is another question from Hajira. Why is crucial information like this not disseminated and distributed to Americans at large? There is not a single American who would think this is okay. Maybe Dr. Harrington can take this question. And even though you're not in America, you're in the UK. So, you know, it's not, maybe you can tell us how this information is transmitted or is being made public in your country.
So I think we have exactly the same issue as you have in the United States, that it isn't made public. And Dr. Rothchild very, very clearly illustrated exactly that. This information is available if you go looking for it. And obviously, the first time I went to Gaza and I met some amazing colleagues there, and I taught some incredibly bright, able, and very motivated medical students and doctors in training. I then looked everywhere for this information, and it is published. It's published by, the Lancet has published a large amount. Norway has had this reciprocal research interest in Gaza. The Ministry of Health has published an enormous amount. The PCBS, Sustainable Goals, Statistics reports, there are innumerable reports, actually, if you just do a Google search. And I read those avidly, and everything else I could get my hands on women's health. And actually, all of these figures are there, all this information about how much electricity is produced, how much electricity, the Gazans could produce themselves, how much were allowed through Israel, the amount of trucks going through, exactly what was in those trucks, how much came out. So all of this information is there, actually. It's just, I think we turn a blind eye, don't we? We look in our own countries, and perhaps we're not very interested in the problems of others. And it's only when you meet people and see them as other human beings with the same wishes for their families, for themselves, that you see the human, and then you become interested in the human. And I think it's very easy to just get on with our lives and ignore it. And we're, of course, concentrating on the absolute humanitarian catastrophe that is Gaza at the moment. But there are many of these across the world, not as desperate as the situation currently is in Gaza. But there are many places that perhaps we are not so aware of these facts and figures.
Yeah. Thank you so much.
We also need to remember that there's a huge propaganda machine that comes out of the Israel lobby and out of Israel itself, trying to control the message. And if you express solidarity or sympathy with Palestinians, you get attacked. I mean, that is very, very powerful in the United States. And I think it's also true in the UK.
It is. And I think people get mixed up between, we're talking about health here and we're humanitarians, and we're talking about, health inequalities. And I think people get very frightened that they may be, misinterpreted. They get the politics and sort of slightly mixed up. And you can call out these things. As a doctor, particularly, we have a duty to.
Just like Dr. Rothchild said, the oppressed needs a microphone, not just a voice. So I think, our job, who are anywhere in the world, who know about what's happening in any place where there is suffering and oppression, it is our job as people in any prominent position to actually shine light on it, speak up, and not be afraid to actually speak up for the oppressed and demand that they are treated like humans, and that their conditions are immediately improved as soon as possible. Thank you so much.
Thank you so much for your words. My name is Harith. I'm a pediatrics resident at Boston Children's Hospital. And just, I wanted to say, like, as a pediatrician, something that I found absolutely heartbreaking was seeing that photo of premature infants, like at Al Shifa Hospital, who are supposed to be in incubators, who are supposed to be hooked up in ventilators, just wrapped up in blankets and kept in like the surgical OR suite at a temperature controlled room. And just knowing that without the proper support, that those infants were imminently and have already died. And I know like there have been spokespeople from the Israeli side saying that they're like, you know, welcoming evacuation and things like that. But even on attempts of that, there are like snipers outside of the hospital. There's like so much violence outside of the hospital where evacuation routes are not even safe. And then of course, not even having enough fuel and resources to transport those like medically complex infants out of there. Have there been any like movements or advocacy from like on the ground to like help these infants or even help like high risk OB patients get out of Gaza and get appropriate medical treatment? Or is it just like an impossible situation right now?
Can I take that first? Is that
Yes.
all right? So first of all, to say, whilst those little tiny babies are, as you say, absolutely horrific to see, and the situation is absolutely dire. And as you say, those babies, you know, do rely on needing fuel for incubators. There are over 5,000 children who have been killed, babies and children. You know, I think the focus, you know, on those tiny little babies in the incubators almost can miss the point that there are that many children who have been killed and caught up in this, you know, innocent civilians caught up in this. And so whilst that is a desperate situation, I think it has the potential to be sort of used and maybe even abused, really, you know, bringing in battery incubators, you know, and evacuating them out. And suddenly that's a heroic situation, isn't it? When actually, you know, the bombing has caused the death of, you know, how many thousands of children more under the rubble. And you're absolutely right. It is at the moment impossible. What we're hearing from our colleagues within Shifa and elsewhere is that, I mean, Shifa is ceased to function as a hospital. It is, you know, down to its last little bits of electricity. They've run out of food and water. You know, it's not functioning as a hospital facility, as are most of the other hospitals in the north of Gaza. You know, there's really only one that's functioning, and even that, you know, they are saving their medicines, their anesthetics for the absolutely, you know, life-saving operations. They can't do. As far as maternity services, because of the overwhelming number of casualties coming in, as happened in 2014, they moved the maternity unit out of Al Shifa, and they actually relocated it to Al Hilo, which is a private hospital that was bombed and has been bombed. Colleagues of mine, several obstetricians have been killed. 2 were killed a few days ago. There were 2 killed earlier on in the sort of bombardment. And talking to one of my obstetric colleagues and the director previously of maternity services at Al Shifa, and the situation is absolutely desperate. They haven't, you know, none of those patients have been evacuated. Women can't even get to the hospitals. MSF said, I think 2 days ago, that there is no antenatal or postnatal care happening now, certainly in the north. Because you know, the health care system in the north is completely broken down, and you know, women can't get there. It's really dangerous. I mean, all around Shifa and those other areas, there is constant snipers and bombing, and you know, getting around is very difficult, and people don't have cars, you know, because they haven't got any fuel. So the whole situation is absolutely desperate.
Dr. Hadeel, would you like to say something?
Yes, of course, I'm just going to emphasize on what Dr. Harrington has mentioned. It's almost impossible to evacuate anyone, because if I understand right, you're thinking about evacuating all these babies outside Gaza, which is actually, it's even in the West Bank, we have restriction movements of transfer of patients between cities, or women accessing hospitals if they want to give birth, like because of the checkpoints and the closures between even villages and the centers of the cities or the hospitals is actually a problem. So evacuation is not an option. And thinking about it, if you want to evacuate all these premature babies outside Gaza, and the mothers and the parents, even, I don't know if they're still alive, of course, but the thing is that, I mean, what's next? It's not the solution. That's not the solution. The solution is actually that those babies, they should stay there safe in the hospitals. And
The
not
mothers
to
aren't all dead, actually. Four of the mothers are dead, but the rest aren't. And so, you know, those children have mothers who are you know, mourning and not able to get to those children because they've had to go home to look after their other children to stay, you know.
Yeah.
And
So
I
I think it's
Dr. Rothchild? Yeah.
I'm sorry, did you want to finish, Dr. Hadeel?
Yeah, I'm fine.
Okay, so I think, you know, when people call about evacuation and various kinds of things, the thing to say is, if you're concerned about these babies, then we need a ceasefire now. That's what's going to save babies, not, you know, bringing in 10 incubators and taking them to, you know, Augusta Victoria in East Jerusalem. We need a ceasefire.
Absolutely.
That's the immediate key, and then followed by massive humanitarian assistance. That's what's going to save patients. And I think we all, you know, people are wondering, what can we do? We need to be calling all of our elected representatives, writing Biden, writing op-eds, writing letters to the editor, going to demonstrations. This is a time when you say, this has to stop, and we need a ceasefire, because that is the only thing that's going to save people.
Thank you so much.
And
Dr.
if our leaders are not going to do it, civil movements will. You know, and that's what will change hearts and minds. So it is us, as you know, as the civil population, that will bring about it. So every pressure that you can, I think that's the way forward.
And, you know, we need to pressure our professional organizations as well to make statements. I believe the American Public Health Association has worked on a statement. I don't fully understand where in the policy thing it is in their conference, but calling for a ceasefire. We need every professional organization to be calling for a ceasefire.
So all our medical colleges, we've written to them. So the Gaza Medic Voices, that group was the teaching group that I belong to, who set that up, and are doing, you know, all of these things: vigils, demonstrations, writing to everything that we can, putting pressure on everything we can. We're talking to Parliament tomorrow. So I think that's what it's people, you know, that like us, that have to put pressure on it, and you have to use every means possible to write to everyone in influence, and to demonstrate and show that, and absolutely, as Dr. Rothchild said, the only thing that is going to stop the killing is a ceasefire immediately.
Thank you so much. I'll Noor, ask your question.
I have a question, and I do recognize it's not the most urgent question, but I've been struggling a little bit as to how can we advocate for Palestinian women without making any room for any Orientalist view that, you know, Muslim women are in need of help or being liberated, or any Orientalist savior complex. How do I speak of this without enhancing what already is a very racist view and very disturbing view, especially coming from, I mean, I'm also Arab and Muslim, so I'm really struggling talking about this with friends and people who don't necessarily share that identity with me.
Anyone wants to answer this? It's a very hard question, Noor, to answer. Well, I mean, maybe I can try to answer it for you. So as an Arab and as a Muslim myself, I think that we should be confident with our identity. We should be confident with our culture. And we should not give space for any Orientalist view. Our culture is very respectful of women. Our women are strong, and our mothers have raised very strong daughters, and we empower each other across the border. And we should not accept any Orientalist view of how we see ourselves or how we project ourselves to the world. That is my answer to you, Noor, and we can talk about it more if you like, but be confident and be proud.
I can add to this. I mean, if you were like in a neutral land and you meet someone and he doesn't know where you come exactly from, and then you become friends, it's not about like, of course you have to, you are like no different. You're not inferior to anyone else. We were all born free. We are the same. Like it depends. If you were born somewhere else, you would have a different identity. You would be in a different religion. It's not about only like, I totally understand that we have this fear, but it's also from the inside. And I think it's our own problem that we make the others believe that we're inferior. This is not right. We have really a lot to share. It's humanity. It's just humanity. So,
okay.
Yeah.
Any other questions from the viewers? Yes.
I also feel like it's really important to talk about the strengths of women and the strengths of the family, and the fact that over half the colleges have women as the students. I mean, the women are the pillar of the society. I mean, you've got to put that all in there, and the immense amount of joy that families have, and that has to be in the conversation all the time and remind people over and over again. They don't need to be saved. They need to have the boot taken off their neck. You know, that's a different messaging.
Thank you. Please.
I have a quick question. My name is Anthony. I work at Boston Children's Hospital as a project manager. As a Palestinian American, I know the culture of Palestine. I've been to Jordan. I know a lot of Arab countries, and how wonderful it can be to be with great people, especially family. A lot of my friends, though, don't see themselves in that culture, and that I get caught in a conversation where they don't necessarily agree with the way of life of Palestinians, let's say. So, Dr. Rothchild, you shared a slide talking about all of the challenges that women face. They've brought those facts up and saying, well, because they face all those challenges, how can I support a culture that I don't necessarily agree with? And then there's a lot of conversation back and forth of, you know, what that culture actually is. But what would you say to that, saying, I can't stand up for human rights, or I can't stand up for this atrocity because I don't necessarily agree with the lifestyle that they would live? Should they go forward?
I mean, for me, that's just an incredibly racist, Islamophobic statement. You don't, do a checklist of how much you like your theory about what their practice is to decide if they're a human being. I mean, Palestinians are guilty for being human beings, and I think we have to be very clear that's racist. I don't know.
No, I was raising my eyebrows for exactly the same reason. All I can tell you is the UK does not have, it is not an equal society either. And I know that the United States isn't, or certainly my impression of what I have read. So, who cast the first stone? What I can tell you is that the women and men, it's an incredibly well-educated society, actually. And if you look at the percentage of students going on to higher education and then on to university, it is staggering. And women actually, even more than men. There then becomes a problem with unemployment in young people, in these professional young people who don't, there isn't employment for. But those women are equally welcomed into, for example, in our, what we're talking about is, medicine here, but into medicine, into law, into engineering. So I'd be a little careful. I mean, we all have our own cultural things, and we are all pushing at glass ceilings, and nowhere, but these are humans who deserve the same rights and same rights as everybody else.
I will, if I may, I'll just answer you. So again, I'm Palestinian and I'm Arab and I'm Muslim, and I work in the refugee camps in Palestine. And just to give you an idea, the women in the refugee camps, really, they rule the street, they rule the home, and they rule the money and how it's spent. And they actually are very empowered. I work with community health workers in the refugee camps, and they are very capable, very confident, and they take care of everybody. And the Arab culture and the Palestinian culture is a very warm and supportive culture. And there is a lot of power in community that one can lean on that we do not have in the West. So even, when somebody is not feeling good, when somebody is poor, when somebody is sick, the social fabric and the community fabric is much, much more powerful than what we see in the nuclear kind of families that we see here. So there is really, it's the argument is completely invalid, and your friends should know better.
Thank you. So I'm going to tell Anthony one last thing and then have questions for the panelists. The other thing is back to what you said, it's racism, and it's something we see here in the US. The way the more dominant class lives and behaves is the way we all believe is the right way. And the marginalized classes' way of living always under criticism. So for us who start belonging to the upper class, we look back at our own people as if their way of life is wrong. But again, it's racism, basically, because every society has its pluses and minuses and their strength. One of the things we talk about in equity is that I grew up in Saudi Arabia, and we don't have unequal pay. Like, unequal pay doesn't exist. And it exists here in the US, and we keep fighting for equal pay. But people may look at the Saudi culture and look at other aspects of, sexism. So each society has its own issues to deal with. And I don't think there is a perfect society, otherwise I will go there. But I have a question for Hadeel, Dr. Hadeel, and question for all three panelists. The question for Dr. Hadeel is, we know that the violence right now is not only in Gaza. Gaza's violence is reprehensible and something that is making, I think, most of us not sleep for the past month. But we know that there's also a rise in violence in East Jerusalem, inside what we call the inside Israel, and in the West Bank. How is that impacting women's health and access to hospitals? So that is one question. And the second general question is, I'm a physician and I work with many physicians and nurses and very caring, loving people. But as soon as the topic of Palestine is opened, for many of them, there is this emotional barrier. They don't want to hear, they don't want to listen, they don't want to change their minds. But again, they're very, very good people. However, they've been indoctrinated to avoid that subject and avoid learning about anything pertaining to Palestine. How do you propose we break that barrier, we break that silo? Thank you.
Yeah, so should I answer the first question?
Please, yes.
Yeah, you're absolutely right. Actually, the situation, of course, in East Jerusalem, and inside Israel, I know I don't really have a lot of information. How is it now? Because we don't see a lot of the media, to be honest. How is it like we call it the 1948 areas? But I don't think that they have a problem accessing the health facilities. That as far as I know. What I know, like regarding the West Bank and East Jerusalem, there is a problem of course, as I mentioned earlier, we have not only checkpoints, but we have also kind of put gates on different villages and cities. So we cannot move safely in between. It's not only because of the military attacks, but also because of the attacks by the settlers themselves. So basically, we had a few cases of women given birth at checkpoints or not being able to reach hospital. And actually, we had just recently a woman who was delivered by her husband at home. So what we actually we're trying to do, like in preparedness of that, not a response, like earlier, that we have allocated certain emergency centers, and we relocated some midwives. We provided them with some supplies, like very basic needs for any delivery or emergency obstetrics they can receive in case of these lockdowns. So yes, there is an impact. Also, it's not only the access of these women to health facilities themselves, but also because of the healthcare providers, they cannot reach their areas of work. So many colleagues who work with me, we also relocated them to work at very close to where they live now. But of course, it impacts the whole system. We really do anticipate a lot of problems regarding, like, during the antenatal care, the high-risk pregnancies that will go undetected. There will be reflected also the fear from accessing the hospitals during especially night or evening hours. So we anticipate an increase in maternal mortality and morbidity, unfortunately. So yeah.
Thank you so much.
So in answer to how do we break through?
Yeah. Yes.
So I've been trying to break through for about 25 years, over 25 years. And I find that one of the most effective ways to do this is through personal stories and personal narratives. So you don't talk about Zionism, but you talk about the person you met at this village and what you did together and what they did and blah, blah, blah. And that personal narratives and highlighting personal narratives is very powerful. And, I work with a group called We Are Not Numbers, which is a group in Gaza that mentors young Gazan writers to become more compelling and skilled writers. And then their stories are published on the website and then often picked up by media that's beyond the website. And that's been an incredibly powerful tool. And I suggest, if you're looking for things to show people, that going to that website is really would be very powerful, because these are young people just writing about what happened yesterday and what their lives are like. And, it's their story. So you can't fight it. It's theirs. The other thing I find is that it's very often helpful to use culture. There's a tremendous number of excellent films that have come out that are just, going to the movies. And, it really helps people to get into somebody else's skin, to have an insight into what living under siege might be, or all that kind of stuff. And so sometimes exposing people to film and to literature. There's a lot of literature now being written by Palestinian writers. It can be very powerful in terms of changing minds. But it's a long uphill battle, because there's so much indoctrination, and there's a feeling that if you're sympathetic with Palestinians, you're abandoning Israelis. And it's not that kind of struggle. Everybody needs to be a human being in this setting, and a respected, deserving person.
Thank you so much. One last question. Maybe we can pick, yes. What advice do you have for medical trainees or protest environment or administration?
I missed.
What advice?
Say it again? Yeah.
What advice do you have for a young medical trainee who is planning to speak out or protest happening in Gaza in an unsupportive environment or administration.
Okay, I can start that conversation.
Yeah,
So,
I think Dr. Rothchild would be the right person to answer because you're here in the US and this is
Right.
a question coming from our institution, probably.
So, I've had experiences with your institution and speaking up, so I can speak for
Yeah.
myself. But, so I think that this is a very tricky situation. The Jewish Voice for Peace Health Advisory Council actually got involved with a young Palestinian who, was a fabulous guy and went to medical school in New York and got a residency and yada, yada, yada. And then someone from sort of the Israeli propaganda machine went through his posts, his social media posts, and found something he wrote like when he was 14 or 12 or as a kid, at a time when Israel was bombing Gaza and his family was being bombed. And he wrote, F Israel and some other hostile things, which you might think a 12-year-old would do. And then this kind of filtered up to the hospital administration, and he ultimately lost his residency. And it was like a 2-year or so court battle and all sorts of stuff to get him reinstated. So there is risk to speaking out, and there is risk to being public. On the other hand, it is very important for us to live principled lives. So I think, first of all, scrub your social media of any stupid things you might have said when you were 12, even if you feel that way. It's not useful. You are now a professional person. And then if you're going to speak out, be sure you have built a community of peers with you, so you're not alone. And that is absolutely critical because you will undoubtedly get attacked. I mean, years ago, when I was, attending at when it was Beth Israel Hospital, not Beth Israel Deaconess, my chief was a very strong Zionist. He would take doctors to Israel to see the emergency facilities and blah, blah, blah. And I noticed that attendings were giving, they would go, provide maternity care in Afghanistan after an earthquake, and then they would come back and give grand rounds, and everybody loved it. And so I said, well, why don't I give grand rounds on the impact of occupation on healthcare? And he was like, this is so not happening. And so for several years, I sort of pestered him until it was very clear. And he actually told me I was a danger to the Jewish people, which I thought was pretty interesting. And then finally he left. And then another chief came, and I said, I really want to do this, and it's my right to do this as an attending. And she let me do it. And when my talk was announced, they got 100 emails saying that it had to be canceled. And she was very brave and courageous and said, you can do this, but, don't screw up. And, the place was packed. It was so tense. But, I gave this sort of scientific presentation quoting the UN and, all sorts of medical institutions. And it was like a medical discussion about healthcare impact on, occupational impact on the occupation's impact on healthcare. And, but it turned into this immense thing. And I could do this because I was an attending. I'd been at that hospital for decades. I think you have to be very strategic and very thoughtful. And, I invited all my friends from any hospital who I ever knew that would be supportive to come. The place was packed, to be sure that I would be protected. It was that kind of event. And I think people have to be strategic and thoughtful and be sure you're operating with a community of peers that will support you. And if you get pushback, if you lose your job, if you get thrown out, Palestine Legal is an excellent group of lawyers that help people who have faced discrimination because of their voice and speaking out on Palestine.
Thank you so much. Thank you for everybody on the panel. Your time and your expertise and your knowledge is greatly appreciated, and we hope we will see you again.